Today's program, Wi-Fi, cell towers, and smart meters, oh my, does man-made microwave radiation impact human health, is coordinated by Kathy Ginn and Marty Wilde. Our speakers are physics professor Davison Soper and Eugene physician Paul Dart. Professor Soper earned his PhD from Stanford University in 1971. He taught physics at the University of Oregon from 1977 to 2013, remains active in research on the physics of elementary particles, and retains the title of physics professor. The Register Guard recently published his guest column, Evidence of Cell Tower Cancer Link is Lacking. Please join me in welcoming first Davison Soper and then Paul Dart to the podium.
I'm Dave Soper. I'm a working physicist. I do theoretical research on the physics of elementary particles. You have no doubt noted the claim made here in Eugene that the microwave radiation from cellular telephone towers can make you sick. This provides me with an opportunity. I've spent a lot of time teaching courses that aim to increase science literacy among the general student body of the university. The same goal should apply outside of the university campus. Having a controversy to draw your attention provides an opportunity to provide a little science lesson while explaining a little about low-intensity microwaves. I hope that you enjoy it. I can report that there is a special joy in seeing the world from the perspective of a scientist. I can also report that being an active scientist helps to insulate me from needless worry. For instance, some people worry about health effects from electric power lines. I don't worry about that. Some people worry that if you vaccinate your child against measles, the child may get autism. I don't worry about that. Some people worry about global warming caused by burning fossil fuels. I do worry about that. Knowing some science helps you sort out real concerns from things that you don't need to be concerned about. Let me emphasize three things about science. First, scientists use numbers a lot, and I will use numbers in this talk. Numbers and mathematics are important not only for the inner workings of science, but also for understanding outcomes. For instance, what if you crash your car into a wall at 1 mile per hour? Not so bad. What if you crash your car into a wall at 100 miles per hour? Disaster. A factor of 100 can be the difference between life and death. Second, science is based on individual research results. For example, Galileo's discovery that the sun has spots on it, or Michael Faraday's discovery of electromagnetic induction. Third, and most important, science is much more than a collection of individual research results. It is a web of connections among facts, summarized in large part by equations that express fundamental physical laws. For instance, Michael Faraday's discovery is now incorporated as part of what are called Maxwell's equations that describe electricity and magnetism. And Maxwell's equations help explain the sunspots that Galileo discovered. They are places of concentrated magnetic field. So let's now talk about electromagnetic radiation that comes from cell towers. The frequency of this radiation is around 1 gigahertz. That may sound a little technical, but maybe you listen to KLCC on your radio in Eugene. The KLCC signal has a frequency of 89.7 megahertz, which is 8.97% of 1 gigahertz. So if you had the right kind of radio, you could just tune to a higher frequency and receive the cell phone signal. The cell tower signal comes in little packets we call photons. The photons come from an antenna at the top of the tower and stream out into the surrounding area. At any location, we can ask how much power per square meter is carried by the photons. That is what we call the intensity of the signal. The intensity depends on the total power of the antenna and how far you are away from it. I was able to locate intensity information for typical outdoor areas in the United Kingdom, which should be similar to what you would find in the United States. In the United Kingdom, the intensity of cell phone signals was measured to be generally less than 1.4 thousandths of a watt per square meter. So let's use that as the value to work with, 1.4 thousandths of a watt per square meter. How much intensity is that? For comparison, sunlight is also made of photons, and the intensity of sunlight is about 1.4 thousand watts per square meter. So the intensity of sunlight is about 1,000,000 times bigger than the intensity of the radiation that you might typically get from a cell tower. 1,000,000 times bigger. What is this radiation? The photons are associated with oscillating electric and magnetic fields. So let's think about the electric field. An electric field can exert a force on the parts of a molecule in your body. Maybe that force could do something bad. So we should know how big the electric field is. For a typical value of the cell phone tower radiation intensity, the electric field is a bit less than 1 volt per meter. How much field is that? Imagine, if you will, a standard 1.5 volt AA battery, the kind you use to run your gadgets. Imagine holding this AA battery in your hand. Surrounding it is an electric field that goes from the plus end of the battery to the minus end. Just next to the battery, the field is about 30 volts per meter. That's 30 times the field of the radiation from the cell tower. Now, I'm not trying to tell you that AA batteries are dangerous. They're not, unless you eat them. I don't advise that. I next want to tell you what happens when this radiation gets inside your body. For that, we should understand a little about what is inside the cells in your body. Your body is made of tiny little cells. They're like little factories, which carry out useful activities to keep you going. Each cell has a nucleus that contains the DNA and a cell wall that separates the inside from the outside, and has little pumps that pump molecules in and out of the cell as needed. There are lots of other structures that we don't have time to go into. Good things happen inside the cell because of various chemical reactions among the molecules that live there. The chemical reactions involve exchanges of energy. To describe this, a useful unit of energy is the unit called the electron volt. For instance, the main carrier of energy for the reactions that run the cell is the molecule ATP, which delivers about half an electron volt of energy. Some other molecule, say protein, can use this energy to make something good happen. Now, most of the molecules in your cells are water molecules, and there is something you should know about them. Your cells are warm. That means that the water molecules are always in frantic, random motion. Typically, a water molecule will be moving at about 1,500 miles per hour. It doesn't go far. Typically, it bounces off something and moves in a different direction in about a trillionth of a second. On a microscopic scale, it's just chaos. How much energy does one of these water molecules carry? Typically about 3% of an electron volt. That tends to mess up the chemical reactions because some fraction of 3% of an electron volt gets transferred to or from the bigger important molecules frequently and at random. Nevertheless, the energy delivered by an ATP molecule is about 50% of an electron volt, which is larger than 3%. Thus, the important chemical reactions that happen in your body can coexist with the random bumping. This brings us to the radiation from the cell tower. It can get into your cells. Then we have a field of about 1 volt per meter in the cell. The cell is pretty small, so from one side of the cell to the other, the electric field amounts to a voltage of about 20 millionths of a volt. I can imagine that this voltage gets concentrated so that it appears across the cell wall or some other membrane in the cell. This voltage can give some energy to an electron or some charged part of a molecule. How much energy? For an electron and 20 millionths of a volt, we have 20 millionths of an electron volt. Does this amount of energy make a difference? That's the important question. We have to ask whether 20 millionths of an electron volt is a significant amount of energy. Do you remember the water molecules? During the time that the cell tower signal is adding 20 millionths of an electron volt of energy to an electron, the molecule where this is happening is hit by many water molecules. Each time, some fraction of 3% of an electron volt is transferred one way or another. That 3% of an electron volt is something like 1,000 times as much energy as one electron gets from the cell tower field. That is, each of these random energy transfers adds or subtracts roughly 1,000 times as much energy as is added by the electric field from the cell tower. I conclude something important from this. The energy that might be delivered by the cell tower field is too tiny compared to the random bumping to have any effect. Could microwave photons ever do anything bad for you? Sure. The energy from the photons is absorbed in your body. It warms up your cells, which can be bad for the cells. But the intensities that we are talking about are way too small to cause significant heating. For instance, sunlight can cause significant heating, but our typical cell tower radiation has 1 part in a million of the intensity of sunlight. This ends our little science lesson. I conclude that it is just not plausible that the signals from cell towers can cause harm. In addition, scientists have been working on this problem for over 20 years, and they have not come up with a way that the signals from cell towers can cause harm either. Nevertheless, we can try to look for other evidence of harm, keeping in mind that it should be really solid evidence, repeatable in different laboratories. First, it is alleged that exposure to low-level microwave signals like that from cell towers can cause acute illness in certain individuals who are said to suffer from electromagnetic hypersensitivity. Symptoms include headache and sleep disturbance. It is claimed that the most sensitive patients always react, or almost always, to radiation and almost never react when there is no radiation. Now, it is clear that there are patients who have symptoms, but do microwaves cause the symptoms? We can try to find out by experiment. We simply need to find a sensitive person and put the person in a room where there's radiation or there's not radiation. Then we see if that person complains of symptoms. We need to repeat this over many trials with the radiation on or off at random. During the experiment, no one should know whether the radiation is on or off. According to the model we are testing, the person should complain of symptoms when the radiation is on and be free of symptoms when the radiation is off. This sort of experiment has been performed multiple times. Sometimes there is a reported result confirming the existence of electromagnetic hypersensitivity. However, sometimes experimental results are wrong. The key is to see if the result is replicated by other experiments by different groups. As a working scientist, I can tell you from experience that sometimes experimental results are wrong. So I need to see confirmation. In this case, the confirmation is lacking. There was a nice review in 2005 of the results from this kind of experiment. I quote from the review. 31 experiments testing 725 electromagnetically hypersensitive participants were identified. 24 of these found no evidence to support the existence of a biophysical hypersensitivity, whereas 7 reported some supporting evidence. For 2 of these 7, the same research group subsequently tried and failed to replicate their findings. In 3 more, the positive results appear to be statistical artifacts. The final 2 studies gave mutually incompatible results. I conclude that electromagnetic hypersensitivity is not confirmed by direct experimental evidence. It is also alleged that exposure to low-level microwave radiation can cause brain cancer. These cancers are rare, so this claim is not so easy to test. There are lots of studies. To study the studies, health organizations have appointed expert panels to critically examine the evidence. In one 2011 report, the International Agency for Research on Cancer of the World Health Organization classified cell phone radiation as a, quote, possible human carcinogen. I might point out that most of the evidence in humans comes from asking people who had developed cancer whether they use cell phones and comparing that to results from asking people who do not have cancer whether they use cell phones. Thus, it is clear that if there is an effect, it is from the phones, not from the base stations. This is significant because the radiation from a phone held right next to your head is a lot stronger than the radiation from a cell tower. I think that we have to consider carefully a judgment that cell phone radiation is a possible human carcinogen. However, let me point out two things. First, a minority of the panel judged the evidence in humans to be, quote, inadequate. Second, the standard of evidence for classifying something as a possible human carcinogen seems not to be very high. For instance, the same organization also classifies coffee as a possible human carcinogen. Whoa. I saw that some of you at City Club enjoyed a cup of coffee at lunch. Are you in danger? Well, ask me at the question, period, but not according to me. To put this in some perspective, let's look at the opinions of some other expert review panels. Here is what a 2012 report of the Swedish Research Council for Working Life and Social Research said. Quote, overall, the data on brain tumor and mobile telephony do not support an effect on mobile phone use on tumor risk, in particular when taken together with national cancer trend statistics throughout the world. An expert committee appointed by the Norwegian Institute of Public Health concluded in 2012 as follows, quote, the large total number of studies provides no evidence that exposure to weak radio frequency fields causes adverse health effects. The French Agency for Food, Environmental, and Occupational Health and Safety has established an independent expert group to give advice. In 2009, that group reported, quote, if there is a risk associated with mobile telephony, it is low and related to mobile phones and not antennas. No scientific study has, indeed could, highlight the biological effects that would involve a health risk for a population living near mobile phone base stations, given their low level of emission of electromagnetic waves. The 2013 update confirmed the lack of evidence. It did advise limiting exposure, although it did not advise changing current exposure limits. In Spain, the Scientific Advisory Committee on Radio Frequencies and Health studied Wi-Fi in 2011. It concluded that, at least to date, there is absolutely no scientific evidence that exposure to the low emission levels of these systems produces adverse health effects in school children. There are therefore no reasons to suppose that such Wi-Fi systems should not be used by school children or other population groups. In Germany, the government set up a commission on radiological protection to offer an assessment. The overall assessment in 2011 was that there is still no evidence for any link between mobile phone use and cancer. In the United Kingdom, the Health Protection Agency set up an independent advisory group, which concluded in 2012, quote, although a substantial amount of research has been conducted in this area, there is no convincing evidence that radio frequency field exposure below the guidelines causes health effects in adults or children. Conclusions. I asked whether low-intensity microwave radiation could induce harmful chemical reactions inside our cells. I concluded it could not. The argument that I gave is a scientific argument that can be rebutted by a scientific argument showing the opposite. I eagerly await the rebuttal. I considered briefly the claim that low-intensity microwave radiation could cause acute health effects, and there seems to be no reproducible confirmation of this claim. Finally, I considered the claim that low-intensity microwave radiation causes brain cancer. This claim ought really to refer to cell phones held next to your head, not signals from cell towers. However, the evidence is at best weak. I'll be happy to answer questions in our question period.